Okay, so we talked earlier about the blue bloaters. This is chronic bronchitis. And you should know the two conditions that we refer to as being chronic obstructive pulmonary diseases. That's chronic bronchitis and emphysema. Now, in the case of emphysema, what happens is that the walls between the alveoli break down. And so small, very small sacs enlarge to become one big sac. Um, the end result is there's less surface area for gas exchange to occur. Also, where the breakdown has occurred, you get fibrous tissue, almost like scar tissue, which does not stretch in the same way that the elastic tissues do. So the airways will often collapse during expiration. Um, Patients have to work to exhale because the elastic tissues are no longer drawing the lungs down. So we actually have to use the uh, external or the intercostal muscles to do this. Um, they have to breathe more deeply, really work hard at it. So they do tend to get a barrel chest. They don't tend to have the cyanosis that you see with chronic bronchitis, but they have to, again, work to breathe out, so they tend to puff. They go puff, puff, puff. And these peaks are sometimes referred to as pink puffers. In fact, I've had people with this condition in the dental chair, and they were just struggling to breathe, and at the same time they would have the cigarette tucked behind their ear that they were ready to smoke as soon as they got out of the operatory. Some other disorders, and you should know these disorders and their descriptions. So we have infant respiratory distress syndrome, and in this case, what's happening is there's an insufficient amount of surfactant. So this is going to be seen particularly with premature babies, but can also happen with full term. Cystic fibrosis, this is a genetic disorder, and there is just one missed or misplaced amino acid, but the end result is that the pumps that move sodium and potassium, well, a sodium pump basically, uh, results in having a thick, viscous mucus instead of a watery, serous fluid. This mucus clogs the respiratory system, makes it very difficult to breathe, and people with cystic fibrosis don't have a terribly long life expectancy. Um, Asthma, which is an inflamed, sensitive bronchioles, uh, irritants. Basically, it's an extreme allergic response going on there, and you end up with dyspnea, that is difficulty breathing again, coughing, and wheezing. There's also sudden infant death syndrome, and there are several things that are causative factors here. Basically, what happens with SIDS is that apparently healthy infant stops breathing and dies during the sleep. Now, it looks like some of this is because of neural respiratory control. The baby just forgets how to breathe. Um, about a third of the cases appear to be due to some heart rhythm abnormalities. That is, the heart just stops. Um, and both of those may have a genetic component. Now, another thing that has contributed to this, um, they always talk about putting the baby on the side or putting the baby on its belly or on its back. That seems to change from year to year. But they did some research several years ago and did find that, at least in some cases, what they were dealing with was a product of postpartum depression, in that moms were suffocating their babies. Now, I don't know what extent, how much of the population does that or did that, but that is one possible aspect of this sudden infant death syndrome. little bit on lung cancer, and there are three major forms of lung cancer. You don't need to know these types. Just know that it is 1/3 of all the cancer deaths in the United States. So this is our major cancer. And then you have breast cancer, prostate cancer, well, actually skin cancer uh, before those two. Generally, what we see is an increased incidence associated with smoking. I shouldn't say generally, most lung cancers are a product of smoking. Um, I had a pathology instructor who uh, went to school back in the 1920s, and at that time, people were not smoking um, cigarettes so much. They smoked pipes. You could get oral cancers, but they didn't breathe it into their lungs. Um, and he was called in to see a autopsy because the person had lung cancer, and he was told this was so rare that you'll probably never see it again. So this is actually a fairly new condition um, brought about by lifestyle choices. Here are some pictures of some lungs. Here is a healthy lung on the left-hand side, and here's a smoker's lung on the right-hand side. And you can see the damage that has occurred to the smoker's lung, and a lot of these tissues are cancerous. Now, let's see. There's not much that I want you to know about the developmental aspects of the respiratory system other than that surfactant molecules don't appear until about the 28th to 30th week of pregnancy, and as a result, babies born prior to that are going to have some respiratory issues. Now, what I am interested in are the aging effects. This is something that we all have to look forward to, and here's what you need to be aware of. As you get older, the elasticity of the lungs decreases. So you have to start to work to breathe out. Sorry. Vital capacity decreases, and that's because the compliance of the lungs, the muscles get weaker, we can't breathe in as deeply as we used to, and the elasticity decreases, so we don't breathe out as much. As part of a product of this is that blood oxygen levels decrease, but that's not the only thing. Just the tissues become a little thicker, so the gas exchange doesn't occur as readily. As a result, the effects of carbon dioxide decrease, so we end up with progressively higher levels of carbon dioxide in our bloodstream. The elderly, as a result, are often hypoxic. They just don't have enough oxygen, and they may develop sleep apnea. Um, in general, you're more at risk for respiratory tract infections as you get older. And that completes our presentation. I think this was the fourth of four on the respiratory system. Hopefully, this material will help you, and thank you very much.